Hi, this is Zach Matuzin, MD4, and I wanted to take a couple of minutes to review the concept of determining patient capacity. It's something that we do on a daily basis, but has many nuances and can quickly become complicated to assess. We're going to review Cooper protocols along with some pitfalls of determining capacity. To start with, there's a difference between capacity and competence. Capacity is the medical definition or our assessment of whether a patient has decision-making capability. This is determining after we evaluate the patient, obtain a history, vitals, exam, and everything else we do on a normal patient encounter. Competence is a legal term where the courts determine that decision-making capacity is present or not. So we determine capacity, not competence. Cooper Protocol 8.7 is the one that outlines patient refusals. In order for a patient to refuse, they have to have capacity. This includes the patient being awake, alert, and oriented times 4, but that's not the only requirement needed. The patient has to be sober with no intoxicating substances, no alcohol, drugs, etc. We judge this and subsequently document it in several different ways. The patient is coherent, no slurring of speech, can ambulate independently, assuming there's no underlying limiting mobility factors. They can have a normal conversation, things like that. They shouldn't have any signs of acute mental disease, so no suicidal ideation, no homicidal ideation, no auditory or visual hallucinations. In many of the site calls, there's a third party, a family member, someone else who's called for the patient. It's our job to also talk to that family member to get corroborating information on that patient. Unfortunately, there's multiple cases where patients with acute mental illness will not admit to a suicide attempt or self-harm. If there's conflicting stories between family members and the patient, call medical command for guidance. Next, the patient can't have any signs of significant head injury. Next is no hypoxia or acute respiratory distress or no hypoglycemia. Those are all kind of obvious. The last one, no acute medical conditions, can be complicated as many times we can't tell if there's an acute medical condition in the field. If the patient has altered mental status or combative, assuming the scene is safe, then they should all be transported to the emergency department. The more complicated one is abnormal vital signs, but that should prompt a call to medical command. Which kind of brings me to the next point. If in doubt, call medical command. Talk with the command physician. The command physician can talk to the patient and anybody else on scene to help kind of parse out whether capacity is present. Many of the situations we respond to are complex and information is really limited. While we don't want to force anybody against their will to go to the hospital, if the patient doesn't have capacity or if there's concerns that the patient may lack capacity, particularly in the mental health calls, it's safer to transport through the emergency department and let us sort it out. Just a quick word on pediatrics. So, pediatric refusals are always a little bit complicated. Just remember that a parent or legal guardian must be there to give consent for treatment, but if no one is available, there's implied consent. And just remember that even if a patient is less than 18 years old, there are certain instances where they're emancipated minors. So if they're legally married, if they're entered into military service, currently pregnant, or declared by a court or administrative agency to be emancipated, then they do have the ability to make their own decisions. So this is coming right out of our protocols that you can use for a reference in an emergency or non-emergency situation. When a parent or guardian is present, you must obtain consent in order to render treatment or transportation. But if the parent or legal guardian is refusing to give consent or transport, and you feel that the treatment or transport is necessary, you should obtain assistance from police and an EMS supervisor in addition to calling medical command so that we can speak with the parent or legal guardian. If the parent or legal guardian is still refusing and medical command and everybody on scene is comfortable with that and there's no one directing the removal of the patient to the hospital, then you can grant them the refusal in that instance. So there's a lot of nuances. There's a lot of specific scenarios that come up. So please don't hesitate to give medical command a call. We're there to kind of guide you. And if there's any concerns or questions, please don't hesitate to shoot me an email. Stay safe on the streets.